am sure that no one would argue with the fact that illness, diseases, accidents, and sicknesses are important. And it's something that we all, many of us are faced with throughout our lives. Sometimes we assume that it only applies to adults, and sometimes only applies to senior citizens. But when the truth is told, you know, those are factors and dilemmas that face individuals all through life, even babies and young people and 5-year-olds, 6-year-olds. So it's important that there's some kind of system in place to treat babies. And treating baby is called pediatric care.
Yes.
Yeah, so we're going to talk today about pediatric care and the pediatric emergency room that's at Navicent's Health with Dr. Rogelio, Dela Cruz. This is a call to action.
A call to action.
I'm your host, Alex Habersham, and as I said, I'm real happy to, first of all, I'm happy to broach the subject and to talk about it because it's something that all of us are concerned about because, of course, we all put a special emphasis on babies and children and, of course, want them to be healthy. Mm-hmm. And if, in fact, something happens to them, we want them to have excellent care. So why is there a need? No. First of all, tell us a little bit about yourself.
Yes, my name is Rogelio de la Cruz. I'm a doctor of medicine, and I originally came from the Philippines. We moved here to the United States in 1992. I went to New Jersey to do my medical training. So I specialized in pediatrics in New Jersey, did that for 3 years. After that, I went to Kentucky and then Jacksonville, where I practiced as a general pediatrician. And then from there, I went to Gainesville, University of Florida in Shands, did additional training for 3 years in pediatric critical care. And when I finished, I joined the Navicent Health, or formerly the Medical Center, in 2004, and I joined the critical care team. So I started there as one of the intensivists. And last January, I decided to switch my career to pediatric emergency room, and with encouragement from the administration, especially Dr. Ninfa Saunders, she asked me if I can help the medical center open up our pediatric emergency room because the city of Macon has long needed a pediatric emergency room, a real pediatric emergency room, an emergency room where real emergencies can be handled. And that's the reason why we decided to open our emergency center, and we started it. It's been open for a long time now, but we formally opened it and named it the Pediatric Emergency Center this past July, August, but we really opened way back January of this year.
Okay, that's very interesting, and congratulations on
Thank you.
Specializing in pediatric care. Congratulations also on your career, and I can tell that you love it and you are always trying to learn more about it and to advance in your field.
I do.
Let's try to get an understanding here. Mm-hmm. What is the range for pediatric care age-wise?
So it really can range from newborn up to age 18, and we will still see if they're seeing pediatricians and if they have chronic illnesses and they're still seeing pediatricians, we might see patients up to age 21 and below. But in our emergency room, we see patients below 18 years old.
Okay.
So from birth up to below 18 years old, we'll see them in the emergency room.
So it's nothing unusual for 15, 16, and I guess what happens is that oftentimes when a child is born, they go to the pediatrician, but they continue to see that pediatrician, up until their teenage years.
Yes.
Yeah, that's very, very interesting. Now, why would there be a need for a difference in pediatric care and just regular adult care or senior care?
Yeah, so first of all, pediatric patients are really not small adults. Okay, pediatric patients need special care. They need someone to take care of them, someone who knows the anatomy, physiology of a pediatric patient. Pediatric patients have different illnesses, the etiology or the causes of diseases in pediatric patients are usually different from adults. Adults more likely will have heart disease, kidney disease related to chronic illnesses related to bad habits, smoking, drinking, and internists are highly capable of treating patients with these illnesses. Whereas pediatric patients, most illnesses are related to infections, related to they may be born with congenital diseases. Pediatric patients may develop illnesses from accidents, accidental falls, or motor vehicle accidents. And these are illnesses that we as pediatricians are very capable of handling. In our emergency room, we see a lot of patients who are victims of motor vehicle accidents. We see lots of patients, pediatric patients who come in because of seizures, because of accidental falls. We see lots of patients with broken bones, and as I said, these patients should be handled by specialists who just handle pediatric patients, because the instruments that we use, the medications that we use are different from the medications that we use in adults. In addition, pediatric patients, especially when they're seriously seconds really count. If you're not able to provide the necessary care, pediatric patients can deteriorate quickly. So It's really very important that someone who knows what they're doing attend to pediatric patients as soon as possible.
Yeah. Now let's talk about some of the common diseases of pediatric patients, and particularly young people. I don't know that much about it, but I have heard that ear infections are very, very important to treat. And it's my understanding, I'm not a doctor, that sometimes because babies get ear infections, then that affect their ability to hear. So
yes, so ear infections are very common. It can happen in children as young as infants or neonates up to adults. Okay? But it's very common in pediatric patients, and it usually starts with a common cold. The problem, if ear infections are not treated, it can lead to hearing loss. It can lead to sometimes even lead to complications like a brain abscess. So it's very important to recognize or treat ear infections immediately, because this can lead to complications. It's very common, especially when the weather starts to get cold, because children start to get runny nose. It's also common when the allergy season starts, because children start having runny nose from allergies, and nasal congestion from allergies can lead to ear infections. So that's why it's really important to be aware of this problem.
So, although you mentioned a couple like runny nose and a change in the season and things of that nature, are there any signs? And I'm just in hearing people talk. They really talk about the seriousness of ear infections, but oftentimes, it's my understanding that oftentimes they go untreated and can result in more serious type symptoms or results like loss of hearing and things of that nature. So are there any, and this might be a tough question, but I'll ask you anyway. Are there any signs, that parents and adults and aunts and grandmamas can look for as it relates to when one has an ear infection?
Yeah. So in young patients, sometimes they will just develop low-grade fever, or they'll just be irritable. They'll constantly pull on their ears. So that would be some of the signs and symptoms that they can watch. In some more serious cases, some patients will actually perforate the eardrum and will develop some pus draining from the ear.
Wow.
Yeah. So, and again, some of these patients who develop more serious complications, they can just develop brain abscess or meningitis because of untreated ear infections. So those would be the symptoms can range from simple fever, irritability, to even, as I said, signs of meningitis.
Yeah. So how does one determine if, in fact, you as a pediatric physician, how do you determine whether or not an ear infection?
So what we do is when they come for a visit, we start with a good history taking, and after taking a good history, we examine the child from head to toe. And normally, if we look at the ear, if it's infected, we will definitely see evidence of ear infection. It's gonna be, when we look at the eardrum, it's gonna be bulging and it's gonna be red. It's not gonna be moving. So that's how we determine if they have an ear infection. And we usually start them with simple antibiotics, or not simple, but we start them usually with amoxicillin, unless they have an allergy to amoxicillin. That's usually the first drug of choice. Or sometimes we would just treat them with decongestant and wait, or just follow them up and see if it gets worse. Most of the time, we would start them on antibiotics.
Yeah. Okay. Now, what is the extent of the pediatric emergency room? How does that operate? Is its purpose like when a child is real sick, when they feel like it's life-threatening or real serious, or if they are in an accident, then that's when they come? Does it operate primarily on emergencies?
So our emergency room is completely different from other emergency rooms, and the reason why I say it's completely different is because our emergency room is very capable and equipped, highly equipped with all the necessary tools to take care of very, very sick patients. We have all the subspecialists ranging from neurosurgeons, orthopedic surgeons, pediatric surgeons, hematologists, oncologists, cardiologists. So we have all the subspecialists. When patients, for example, get into a car accident and they develop a head injury, you cannot wait for them to get those consultations. When they get seriously ill, as I said, following a head injury or a fall from a head injury from a fall or from a motor vehicle accident, they may be bleeding in the head. And in our emergency room, because we have a group of trauma surgeons, these patients get attended to immediately. We scan them right away. We examine them. We scan them right away. And if they need surgery, our neurosurgeons take them to the OR immediately. Okay, so there's no time wasted. These patients get treated immediately. if patients don't get treated immediately, let's say they're bleeding in the head, they can suffer irreversible brain damage, and this is not good for the brain. So you really cannot waste time in some serious events like this. Our emergency room also is unique in the sense that we have the subspecialists. Like if you break a bone, you can just come to our emergency room. We will sedate you. We will put your children to sleep and sedate them, and the bone can be set back to its normal place in our emergency room. You don't have to be transferred to another hospital because, as I said, we have orthopedic surgeons working in our on call. And the advantage again is in our emergency room, we are very capable of sedating patients. It's very important when you do a procedure to pediatric patients that these patients do not remember anything. You know, it's very important that they do not feel any pain. So it's something that we can assure parents that when they come to our emergency room and we do a painful procedure, we can assure the parents that this procedure will be something that will not be too traumatic for the patient because we can sedate their children. We get a lot of patients with broken bones, and as I said, our orthopedic surgeon fixes them back, sets them back, and we put these patients to sleep. So when they wake up, they don't remember anything. So it's a very pleasant experience.
What are some of the other type? I know we talked about ear infections and we talked about broken bones. What are some of the other type scenarios or situations or illnesses that, you know what I think? I think that oftentimes parents, you know, and it's to the disadvantage of the child. So I think part of our mission here is to make adults and mothers and fathers and grandmothers more conscientious about the seriousness of the need for
That's a good question.
Pediatric care.
Good question, Mr. Habersham. You know, I always brag that the medical center is a very good hospital because we have an intensive care unit, and having an intensive care unit, these patients from our emergency room, if they need further care, they can just be transferred to our intensive care unit. And one common illness that requires ICU care is asthma. Okay? Asthma is a serious illness, and most parents are not aware that asthma is a leading cause of death among children.
Wow.
Because when children start having an asthma attack, you know, the airway is a very important organ of your body. So if you're not able to breathe from an asthma attack, you won't be able to bring oxygen to your lungs and eventually to your brain. And some of these patients die at home or even die on the way to the hospital. Okay, so now that the weather is getting cold, asthma is something that we are seeing a lot in the emergency room, and our emergency room is very capable of managing this type of patients. We see a lot of patients with severe asthma attacks. We give them the necessary treatment in the emergency room, and if they need further care, we are able to continue the care in our intensive care unit.
Okay, so the scenario is, the way that it works is when you have a pediatric patient, then the beginning process is to take them to the pediatric emergency room, you know, if it warrants it.
Yeah.
And then once you get them stabilized and diagnosed and determine what the problems are, then of course you've got the other resources depending on, you know, what the problem is to still continue to treat them in an effective manner. Well, sometimes when people need emergency room care, I've seen many instances where adults have had babies in regular emergency rooms. So I guess it's your premise that if it's a pediatric patient or a patient that qualifies for pediatric care, then they should not go to the standard emergency room. Should they come to the pediatric emergency room, say a 5-year-old, with asthma and a broken bone?
Yeah. So most of the time, children will have illnesses which will require what we call acute care or an urgent care. So this can be managed in after-hours clinics or regular urgent care clinics or regular emergency rooms. However, illnesses that don't respond to regular treatments, they are best handled in our emergency room because in cases of asthmatics that get really bad, that don't respond to regular treatment, we're able to intubate them. We're able to put them on the ventilator and bring them to our ICU. Most asthmatic patients, most patients who develop an asthma attack will respond to breathing treatments or steroids. In extreme cases, those who do not respond, our emergency room is very capable of handling complicated cases. So that's what makes our emergency room completely different from other emergency rooms. It's a highly specialized emergency room. We can handle complicated cases, and as I said,
that is very, very interesting. This is a call to action.
Call to action.
I'm your host, Alex Havisham, interviewing Dr. Dela Cruz. He's got a first name, but I always confuse it and I don't want to mess it up. But we're having this very interesting conversation about pediatric care. Dr. Dela Cruz works for the pediatric emergency room at Navicent. And we're just discussing in an effort to educate and inform the community on, the ins and outs and some of the particulars that surround pediatric care, because of course it's our responsibility to take care of our young people educationally and health-wise also, and otherwise. So we want to make sure that they get the optimum care as it relates to health, particularly when there are situations that they would need care and they would need the services of a doctor in the cases where there may be emergencies. So we talked about some of the scenarios, some of the situations, that young people are affected by, like ear infection and like asthma and like automobile accidents and things of that nature. However, it is also very true that there are some critical illnesses, some real serious illnesses like poison and maybe some kind of internal disease and other situations that are not that common, but they do occur. But there is a demand and a need for critical care when these situations exist. So talk about some of those situations.
So in our emergency room, we also see a lot of children who accidentally ingest pills or poisons, and the children think they're candy.
Like everything is candy.
And if they see something in a bottle, they think it's juice. So most of the time, children will ingest this, and of course, this can cause some problems, especially if they aspirate this or if they taken an overdose. It can cause lots of problems. So we see a lot of those cases in our emergency room. Most of the time, we're able to just observe them. Some of them, if they are serious enough, we treat them in our emergency room and then we admit them to the ICU for observation. I would like to make a special mention. Our emergency room is a level 1 trauma center, and being a level 1 trauma center, we get all the serious accidents that happen along I-75. And I would like to make a special mention regarding Taylor. He is, I think he's now 6 or 7 years old. When I was still working in the ICU, he was in a motor vehicle accident, and he was in a bad motor vehicle accident. He was brought to our emergency room where diagnostics were done, CT scans, and he was examined fully. And luckily, we had a trauma surgeon who's always on call 24 hours in the emergency in the hospital that took him right away to the OR and fixed all the abdominal injuries and lung injuries that he sustained. And after that, he was taken to the emergency room. So if there was a delay of care, he would have not made it. But fortunately, he was taken to our emergency room immediately. He had the best trauma care, and he was voted the Miracle Child of Georgia. He actually went to the White House, and I think he met Barack Obama. So, and now he's like a normal child, you know. So I'm happy. I'm happy I was part of the team that took care of him when he was in the ICU.
Okay, now what happens? I know some instances, children ingest non-food items too.
Yes,
You know, like marbles and bottle caps. And does that ever happen?
Oh, a lot. Yeah, we. Common problem is they will ingest magnets or batteries like that. Those are emergencies because they can perforate the abdomen and the intestine. So especially batteries, they can burn the esophagus.
Oh my God.
We've had patients who come in because they ingested coins. Some foreign bodies, especially coins, are too big for it to pass through the esophagus or the food pipe. So if you don't get them out right away, then they can perforate the esophagus. And we have ENT surgeons, pediatric surgeons in our hospital staff that can remove this right away. You cannot really wait for a long time because if you go to a regular emergency room and you wait for a long time, you can develop perforation of the esophagus and it might be too late. So the advantage of our emergency room, as I said, we have specialists that can remove this right away. So
that is so awesome. Well, let me thank you, for coming on, Dr. Dela Cruz. So say your first name again.
Rogelio. Roger, okay.
Dela Cruz. That's around the need for pediatric emergency care. There is a pediatric emergency care center at Navicent Health, and we have a very, very capable director here who is very, very trained in it, and it just makes me feel very good to know that there is an entity in our community that can take care of our children. This is a call to action.
A call to action.
I'm your host, Alex Habersham. Have a great day.